नमस्कार, मैं डॉक्टर मुंजाल ठाकर, प्रोफेसर ऑफ मटीरिया मेडिका एंड पीएचडी गाइड एट पारुल यूनिवर्सिटी। आज हम ऑटिज्म के एक केस का वर्णन करेंगे, क्या होम्योपैथी उसमें कर सकती है और किस तरह से हम चेंजेस ला सकते हैं, स्पेशली सीवियर ऑटिज्म में। इसका हम स्टडी, एक केस स्टडी आज मैं प्रेजेंट करने वाला हूं। तो हिस्ट्री इस बच्चे की कुछ इस तरह है। एट द एज ऑफ 3 years, this child was brought to me in 2021, that is 3 years from today. And this child was diagnosed with severe autism when he was brought to me for treatment. The main problem of this child was extreme aggression, extreme irritation and fear whenever he was approached with anybody other than the mother. This included his father, the therapist, grandfather, grandmother, and sometimes even the mother. So much was this child extremely sensitive to the approach of anybody other than the mother. He could not bear touch, he could not bear noise, and he could not bear even someone trying to call him. This was the severity of the problem. The therapist could not administer any therapeutic measures, any kind of therapy, occupational therapy, ABA. This child just refused to take any therapy because the moment he was there at the therapist, he would scream and howl and create a big tantrum, roll himself on the floor, so much so that the therapist had to give up doing anything for this child. Extremely violent was the reaction. This child did not accept anything that was unfamiliar, that was new around him. You could not even make him wear his shoes. You could not even offer him any new food. You could not even give him a paper or a pencil to color, and he would scream loudly. He would avoid every kind of situation where there would be people. And this went on for months together before the child was brought to my clinic to help him. It is as if the mother describes that this child likes to remain in his comfort zone, and from the description of the mother, it almost seemed that this child was in a bubble, in a cocoon, and anybody who would try to, any stimulus that tried to enter this bubble or break into the cocoon would elicit a violent tantrum. The child was impermeable. You could not reach to the child in any form. This child was so sensitive that even the phone app called Talking Tom if that Tom would look at him, he would be screaming. He would start kicking, he would start scratching his mother. It was just impossible. The first day I remember when he tried to reach the clinic, he would totally throw a tantrum as soon as the chamber consulting room door was opened. Such was the situation. This child was a very light sleeper. Least noise and he would be up and again irritated. He would be very irritated as soon as he got out of his sleep. In anger, he would clench his teeth. And anything that would not be up to his taste, he would get very angry. And in anger, he would also bang his head into the person who's holding him. He would even bite when he's angry. He would bite even when he was very excited and happy. You could not even brush his teeth. The only way he could be consoled was a one-to-one interaction with the mother and nobody else. He was scared of new clothes, new objects, and even a new doctor. On his birthday, when you tried to cut the cake, he immediately went away into another room which was not decorated, because the decoration also was a new environment which he could not tolerate. So he went and sat in a corner of a room which was not decorated, which was his usual room. And he had tremendous mood variations. You could not predict his mood, what will make him angry, when he will become angry. Just no clue you had. He had a lot of sensory and perceptual abnormalities. And he would keep looking at the corner of the ceiling. He would laugh without reason, flapping hands, which is very common in children with autism. And the only way he would communicate his urge for stool or urine and water was through his whole body and his gestures to the mother. He was completely unresponsive to calling his name. If you call his name, he made no eye contact whatsoever. And you call his name and he does not respond to the name. He would not even touch anything. He could not bear the sound, the mixture, the pressure cooker whistle, the drill. It would also irritate him. He does not like anyone to touch him, even his mother at times. The only thing that he liked was to play in water. But if you sprinkled water on him, it would irritate him. Seesaws would frighten him. Joyrides would frighten him. And he wouldn't sit on the swing alone. His speech was not developed. And he could not be potty trained. He would stand and pass stools, not sit in the pot. Extremely hyperactive. He is always on the move and running about. And he did not even want to change his clothes. Whatever pattern of the clothes he would wear, the same pattern had to be repeated. Same thing for his food. So you can see that there is a lot of rigidity in his ways. He is very stubborn and you cannot reason out anything with him. And this is a very brief history of this child. And he could not tolerate either too much heat or too much cold. The summers would irritate him and he would prefer open air. He throws off the covers and he would perspire on the part that is lain on. The pregnancy history of the mother had conceived without difficulty, but it was a late but a planned pregnancy. And mother had developed probably a urinary tract infection during the last few months of the pregnancy, and acidity and nausea. The child had some difficulties latching on to the mother's breast in the beginning, but then he continued to breastfeed till the date of consultation, that is till the age of 3 years. His speech was not developed. He was just babbling, which was meaningless, but he could sit till 7 months without any support. He was walking and standing at the age of 12 months, which is normal. And when we started the homeopathic treatment, the first test that we normally do for all our children with autism is called Childhood Autism Rating Scale. It is called CARS. So the first, we will put up the history. We will put up these CARS score sheets in the video. The first CARS score was 51.5, which classified this child to in the range of severe autism. His scores were high in all the parameters that you will see on your screen. All the 15 parameters of the CARS score showed extreme degree of autistic symptoms, and therefore it was 51. After studying the case, the remedy that came up, which was very interesting, and for my homeopathic colleagues, you can see your repertory. There is a rubric that is called, any of the repertory you can see, mind. Under the mind section, company aversion to sight of people, avoids, shuts herself up. Only remedy was curare. And if you put the other symptom, which also I will add in the video, you can study it. The other symptoms of the case, I used the therapeutic pocket book. And the symptoms that I took in the therapeutic pocket book were irritability, better uncovering, aggravation touch, aggravation noise, changeable moods, aggravation after sleep, restless sleep, absent thirst because the child was thirstless, aversion to movement, understanding difficult, muscles flabby. This was the finding that was present in the occupational therapist report. So I want to tell all my homeopathic colleagues that a very detailed study of the occupational therapist report, the psychometric reports, is very essential if you want to understand the finer aspects of treating autism successfully. And the last symptom that we had taken was disgust from food, smell, sight, etc. The first remedy that came up was lycopodium, which did not help the child for the first couple of months, and then this case was re-evaluated, and what we found that within the first around 10-12 remedies, there were 3 remedies belonging to the Loganaceae family, namely Ignatia, Spigelia and Naxomica. And if you study the Loganaceae family, curare is another remedy of this family, and it covered the most characteristic behavior of this child, and therefore this child was given curare. And over a period of within the first 3 to 4 weeks, the first improvement that happened was that the child became amenable to therapy. The child could now tolerate presence of strangers. The child could begin to interact with the environment. And then it's a very long follow-up. So I will share the CAR score sheet. After a year, the scores improved from 51.5 to 43. Again, a lot of details of this CAR score are available, which I will put it in the video. You can study it for yourself. And then in 2023, the CAR score further improved to 34.5, making him mild to moderate autism. Improvement in all the 15 parameters of the CAR score sheet was available, and we are also going to put up this sheet. So today the child still follows up with me, and you will be able to appreciate that from a score of 51.5, in 2 years time it has come down to 34.5. From a severe autism, it is now mild to moderate autism. Had homeopathy not been intervened, this child would not have been even able to receive the therapy. Homeopathy opened up this child to receive the important sensory stimuli, which is a part of the sensory integration therapy. And both, when they come together, there is a newer level of improvement in such severe cases. So do share this video, subscribe to our channel for more interesting experiences. We will keep sharing it with you. And homeopathy, we always recommend in situations like autism, is early intervention. The faster you intervene and not wait for too late, the better is the outcome. So goodbye, and see you all very soon with more experience. On 3rd of April, which is the World Autism Day, we are doing a 1-hour live video on homeopathy and autism. Do share this information with your contacts, and I see you at 3 o'clock, YouTube live and Instagram live. It is a totally free of cost video, so most welcome for all of you, and we will share our experience of last so many years treating with autistic children. Bye bye.